Senior Citizens Day. So we've asked to help make some decorations in celebration of that day. On August 22nd, we're going to be celebrating the day with having a root beer float for all of our seniors here at Evergreen. And our facility is going to be decorated with signs and posters of appreciation from our children. So this is kind of a sampling of what you'll see up in the hallways next week and the week to follow. To continue with the celebration in September, it's going to be National Senior Citizens Center Month. And here at Evergreen, we're going to be celebrating with a decades theme. Evergreen was started in the 80s. So we're going to we'll have pictures. We're asking all of our members to write down fond memories that they had here at Evergreen. In addition, bring in some photographs. So we will line our hallways with pictures from the 80s, 90s, 2000s, 2010, and 2020. This is a great place for the community to come together for our seniors. And myself, I'm the coordinator here at Evergreen, and I'm very proud to be here. We definitely have a group of very loving members. And if you haven't been to Evergreen before for some of our activities, please come. Because we really do know how to have a good time.
Thanks, guys. All right, everybody, up. And left face. Left face. Now forward, march.
At this time, we're going to have the dignitaries and the invited guests to the podium area, please.
Good morning, everybody. Welcome to the Evergreen Senior Center. You know, when you're in my business, there's two groups you never want to follow to the podium. One is pets and the other is kids. Right? So what am I doing following 50 kids who just in a room today with a bunch of signs and pictures, and I got to follow that? That's just not fair. I'd like to again welcome you all here. This is a terrific center. It's the perfect place to host our Congressman Frank Pallone, who's here to talk about the Inflation Reduction Act, which has such a profound impact on our senior citizens through health care and a profound impact on society as a whole through the environmental enhancements it's made. So I just think it's great that he's here in Woodbridge Township and in Evergreen Senior Center in particular. Congressman, this is the oldest and the most active of our 6 senior centers. We have a whole host of people back there who make this a great place. There's Allison, there's Jody, there's Melissa, there's Julie, there's Renee, there's Diane, there's Colette, there's Angela, there's Deb. In the middle over here is Michelle Morgan. She's the Director of Senior Services. And of course, there's Billy, who set up all the chairs in the ring, set up the You got to thank the guy who put the coffee out. I'd also like to introduce my one-time best friend and our Chief of Staff and former councilman, currently the head of all of our redevelopment work in Woodbridge Township, Carolyn Ehrlich. And we have 2 current council people here. We have Sharon McAuliffe, who represents the 1st Ward of Woodbridge proper and Seymour. And we have Councilman Greg Ficara, who is the councilman at large and covers everything. I also want to thank John Haggerty, our communications coordinator, with his deputy Megan Kushba and her assistant Kelly Walsh. They put this all together, and we got a letter email back from the congressman staff saying, wow, we didn't have to do anything because we have such good people here in Woodbridge Township that know what they're doing. And Congressman, I could go and introduce introduce each senior by name, but I don't want to do that. It's going to take up too much time. So let me just say the best seniors in Woodbridge Township are all, they're from, not only from Evergreen. I saw people here from Cooper Tower, Woodbridge, yeah. So I got people here from all over the town. Our 5 different senior housing complexes and our 6 different senior centers are all represented here. So Congressman, let's all of you, give them a round of applause for coming in. Now I'd like to introduce a man who always is in Woodbridge. He represents a very large congressional district. He's one of 435 in the United States House of Representatives. He's one of the more senior members, and he is the head of the Environmental Subcommittee, or committee, I should say. And he has been amazingly helpful to Woodbridge Township since I've been the mayor. In particular, we all know in the last several months back, starting in April and May, with the issue we had with the high school, when you have an environmental issue and your own congressman is in charge of the environmental committee, and you want to call the EPA, the Environmental Protection Agency, guess what? You want to call the Center for Disease Controls, guess what? This man can get you the people you have to get to and talk to, and they all help Woodbridge through that issue, and thank goodness there's nothing in the high school, it's all safe, it's all good. But we didn't know that at the time, and the congressman was so incredibly helpful as we dealt with that issue, and as they did, it has a happy ending, which we're thrilled about. So ladies and gentlemen, my good friend, Congressman Frank Pallone.
Thank you, Mayor, for all those accolades. And, you know, I know that when John says that he can literally go around the room and introduce everyone in the room. I know it's true because I'm always amazed whenever I go to a parade or any kind of event how he knows everybody. And the kids, too. You need to say, you probably know most of them, too.
Not all.
Not all. A lot of them. And that just shows all the work that he does to make Woodbridge better on a daily basis. The fact that you have 6 senior centers is amazing to me because most of the towns that I represent only have 1 senior center. Some of them don't have any senior center. So the emphasis in particular on seniors is really heightened here in Woodbridge with John as well. I also want to thank Carol because whenever I have to do anything in Woodbridge, of course I call the mayor and I call Carol at the same time. I never forget because she's always so involved as well. The council people that are here with me, thanks. Michelle, who else did I forget? I don't know, hopefully. But thank you all really for being here today. The reason I wanted to come today is because tomorrow we're going to vote in the House of Representatives on what we call final passage of this bill called the Inflation Reduction Act. But I want to focus today on the health provisions because I really think it's the most significant health-related bill that we've dealt with since I've been in Congress, with the possible exception of the Affordable Care Act, Obamacare, the Affordable Care Act, which this also builds upon. So I wanted to come here to talk to you about it. And I wanted to explain my enthusiasm, if you can, because when, I don't know how many years ago it was, but I was in Congress at the time when we adopted Medicare Part D, which was the prescription drug benefit. Some of you know that before that there was no prescription drug benefit under Medicare. That's kind of forgotten now, but there was none. But when it was adopted, I was very critical of the fact, and I'm trying not to be too partisan today, but I have to be honest, I was very critical of the fact that the Republicans on my committee, particularly the chairman at the time, insisted on putting in a clause in Medicare Part D legislation when it was first enacted that said that the federal government could not negotiate drug prices. And we as Democrats always were critical of that at the time and after because we felt it was just a giveaway to the drug companies. It was a special interesting giveaway to the drug companies because why would you specifically have to say that the government can't negotiate? Now you should understand, and some people might say, well, why is that significant? It's significant because every other developed country, I don't care if it's France, Australia, Canada, Japan, wherever you go, because they have the buying power when they buy prescription drugs through their programs, they negotiate a reduced price. And yesterday I was before the Rules Committee, which is the committee that sets the debate for tomorrow. We'll be debating and finally vote on this, and it will pass. And I said that how ridiculous that is, because imagine if you go to you go to the Woodbridge Mall, right? And you go to one of the stores, right? And you walk in and you say, look, maybe that's not a good example because, those stores are national. But let's say if you go to a local, you're going to go buy furniture or whatever. And you say, look, I'll come in here and, if you want me to buy just one couch or you want me to buy a sofa or whatever, you'll pay retail, right? But if I go in and say, look, I have all kinds of money and all kinds of ability to purchase, a whole house or maybe 20 houses worth of furniture, then you want to pay wholesale, right? And you want to get a deal. I call it a deal, right? And I want to pay less. So now you have the federal government, and this is the case in all other countries, that says, look, I have the buying power of every senior in the United States that's in the Medicare program. And you can't charge me the price that Rite Aid or CVS is going to charge if I come in and buy one thing. I represent tens of millions of seniors, and I want a discount. So that's what they do, and they get a huge discount. If you take any drug, any prescription drug that you might go and buy today at the local pharmacy, and you compare what that price is that you're paying compared to what they pay in other countries, you'll see that it's significantly higher here. And that's particularly because we don't use the buying power of the federal government under Medicare to pay less. And so why would you preclude that other than it's a giveaway to the drug companies? Now, I don't want to emphasize it too much, but I literally have spent the last 20 years trying to get the federal government to the point where we would repeal that clause and we would insist on a program whereby we would take drugs that have been the most expensive on an annual basis and negotiate the price so that we can bring it down significantly. And that's what's going to happen tomorrow. That is what's going to happen tomorrow. And I don't want to tell you that this is going to kick in right away because it's going to take a while for it to kick in, but it will significantly reduce the prices for prescription drugs within the Medicare program. But now I want to go beyond that. We also believe that, I'm not making it up, that the insurance companies, when they go and cover the rest of the American public, right now we're talking outside of Medicare, they usually insist on the same price that they're going to pay as the government pays for Medicare. So some people have said to me, well, this is fine for seniors and those in Medicare, but what about everyone else? Well, the bottom line is the insurance companies are not stupid. What they'll do is they'll say, okay, Medicare is paying that price. I have millions of people, United Health, Aetna, whatever. I'm not paying more than that. Why would I pay more than that? And so I think that this is going to have an impact even beyond Medicare and the senior community, because the insurance companies will say, I'm not paying any more than Medicare pays. So this is really so significant. Now that's the first thing. But the second thing that this bill does tomorrow is it says that it captures out-of-pocket expenses under for prescription drugs at $2,000 annually. Now, some people may say, well, that's a lot of money. But I'm sure there are seniors in this room that pay $4,000, $5,000, $6,000 a year. And so this will automatically say, you're not paying any more than $2,000 out of pocket. The third thing is we have what we call an inflation rebate. Because we know that during the COVID period in the last few years, they have raised prices on prescription drugs way beyond inflation, all right? Way beyond inflation. I'm sure I can use some examples here. So this bill says that you cannot increase your price from one year to the next any more than the inflation rate. And if you do, then you have to rebate that difference to the federal government. Now again, sure, the drug companies aren't going to want to rebate that difference to the federal government, so they're just going to charge no more than the inflation rate. And then the last thing, which is significant, I'm sure, for a lot of you, is that we also say that you can't charge more than $35 a month for insulin, for those who take insulin. So the first thing, the negotiated price is the most significant, but the other things are in there as well. And that's the combination of all these things that's going to be dealt with in this bill tomorrow. That will then go to the president the next week. The Senate already passed it. That was the biggest hurdle with regard to prescription drugs and trying to make it more affordable. Now, the second thing I want to mention, which may be not as relevant to all of you, but it's relevant to the kids and the rest of the public, is that when we passed the Affordable Care Act a few years ago, when I was there, I was part of negotiating and putting it together, or Obamacare as it's known. You know, this is an insurance program for people that can't get insurance on the job. You get insurance on the job, you get it if you work for the Township of Woodbridge, or you work for a company, you get insurance. Most of it's paid by the employer, you pay for part of it, right? But many people, because we're in a situation now where many people work at home, have their own business, they don't work for a company that provides health insurance. They're not old enough for Medicaid, they're not poor enough for Medicaid, they're not a veteran, whatever. Tens of millions of people in that category. That's why we set up the Affordable Care Act, or Obamacare, a few years ago. But what we did is we said that if you could not afford the insurance, the full rate, we were going to give you a subsidy. And every year we've had to increase that subsidy because insurance rates go up, and a lot of people, fall into a situation where they're working, so they're not seniors, but they don't get insurance on the job. And so we've had a year or 2 years ago when we passed the American Rescue Plan, which was the first bill after Biden became president, we significantly increased the level of subsidy that people will get from the federal government to pay for their health insurance. And we also made it so there was no longer a cap, because there used to be a cap that if you were above a certain income, and New Jersey is a high cost state, so a lot of people they didn't get any help at all. Now everybody gets help, and the amount of help is significantly more. I think for the average person who's in Obamacare, they get over $2,000 to help pay for their health insurance and subsidies from the federal government. But that expires at the end of this year. So what we did is part of the savings the federal government gets from this negotiated prices for prescription drugs is being used to extend those enhanced subsidies for Obamacare, the Affordable Care Act, for the next 3 years, which is again significant, although it doesn't really apply to you as seniors. So those are the two things, and I really can't be enthusiastic enough about this because this negotiated prices and what we're trying to do with drugs is really something that not only myself but all the next 3 people that I'm going to introduce have been working on for years. And so to us tomorrow, when we came in, we were hugging, right? Because we just were hoping that this day would come, and it's about to come. So with that, let me first introduce Ivy Sharmas from Protect Our Care, New Jersey.
Thank you so much. As some of you may know, Protect Our Care is focused on protecting and strengthening health care for millions of Americans. Our founder and chair, Leslie Dodd, wish he could be here today. He is in D.C. So I am here. I'm sorry. Louder. Gotcha. How about this? Better? Okay. Thank you. I'm here today actually to read a statement from our founder and chair, Leslie Dodd. We wish he could be here today. He is in D.C. So I'm going to read this. Is from Leslie Dodd, founder and chair of Protect Our Care. This moment is the culmination of years of work by Chairman Pallone and Democrats in Congress. Without the leadership of Chairman Pallone, this bill would not be on the House floor tomorrow. All of us owe him a debt of gratitude. We all know how being sick takes over our lives. And imagine being sick without being able to afford the care you need. The Inflation Reduction Act will be a game changer for millions of people. Medicare will have the power to negotiate for lower drug prices. Seniors will no longer have to choose between paying the bills and affording life-saving prescriptions. Middle-class families will save on their health insurance premiums and be able to afford care. And many will have health insurance for the very first time. And all of this at a time when Americans are looking for relief from rising prices. We commend Chairman Pallone and the work of every Democrat who stood up to fight so hard against opposition at every turn from Republicans in Congress, from Big Pharma, and other special interest groups. By passing the Inflation Reduction Act, Democrats are demonstrating their commitment to ensuring that affordable, accessible, and equitable health care is a reality for every American. Thank you.
Thank you, Ivy. So next we have Laura Waddell, who's the healthcare program director at New Jersey Citizen Action.
Good morning, Evergreen. How are you? Can you hear me? Yes. All right. I am so thankful to Congressman Pallone and really everybody that I'm sharing this morning with, and all of you. You know, with the current levels of the cost of living and income inequality, the healthcare reforms in the Inflation Reduction Act will bring much needed savings to New Jerseyans. Allowing Medicare to negotiate prescription drug prices means families won't have to choose between groceries or medicine. Extending the Affordable Care Act insurance premiums will help solidify the recent strides we've made in health coverage and keep it affordable for millions of families and Americans. And so again, I thank Congressman Pallone and the rest of our New Jersey Democratic congressional delegation for fighting for these important and historic policies. You know, for decades, lawmakers in both parties have promised to lower drug prices, make health care more affordable, invest in clean energy, and improve the tax systems. And after months of negotiations, Congressman Pallone and the rest of the New Jersey congressional Democratic delegation will have delivered on those promises. You know, even while battling the continued impacts of COVID-19, rising inflation, and a full-on assault from drug companies, oil companies, and other big money special interests who continue to try and stall progress in order to boost profits. But with the final passage, soon-to-be final passage of the Inflation Reduction Act, Medicare will be able to negotiate the prices, as Congressman Pallone said, that you'll pay for certain Part D prescription drugs, and seniors like yourselves will benefit from a $2,000 annual cap on your Part D medications. Insulin will be capped at $35, and for Part D, drug companies will be actually penalized should their prices rise higher than inflation. So these Medicare reforms, they are historic. We of course know that seniors are not the only people struggling to afford prescription drugs, and there is surely more work to do and to be done. But I also want you to be able to tell your families and your grandchildren that although these Medicare provisions, yes, they apply to Medicare recipients, but as Congressman Pallone mentioned, Medicare often acts as a baseline for private insurance. So goes Medicare, so goes the rest of us, as they say. And so we at New Jersey Citizen Action, we will continue to work with Congressman Pallone and the rest of our federal delegation to address prescription drug affordability for all. Because 1 in 5 New Jerseyans are still cutting pills in half or skipping doses due to inaffordability of their prescription medications. And this is 2 and 3 times as severe in Black and brown communities. And we'll also continue to work with our New Jersey legislature and Governor Murphy to bring state-based reforms like a prescription drug affordability board to New Jersey. So yes, we will continue to work to bring prescription drug affordability to all of us. And then of course, let's celebrate the 3-year extension of the increased Affordable Care Act subsidies that are included in this act. And this will allow for New Jersey residents to continue to access affordable ACA coverage, just as they did during the record-breaking open enrollment period last year. You know, at New Jersey Citizen Action, we're not only focused on outreach and advocacy, but we also provide direct services to low and moderate income residents. And one of those services is health insurance enrollment assistance. And through this work, we've heard so many wonderful stories of people who were able to connect to affordable coverage for the first time because of the increased financial assistance available. So more New Jerseyans signed up for the marketplace plans than during any prior open enrollment period since the passage of the Affordable Care Act. You know, New Jersey saw about a 20% increase in fact. So this is a direct result of the many measures targeted to lower premiums, which allow for these historic levels of financial assistance and increased affordability for so many in our state. So having these subsidies will continue to mean so much for so many. And you know, we've all talked a bit about, you know, how the Inflation Reduction Act helps people, but I would be remiss if I didn't mention how it helps the planet and the economy by making the largest to-date investment in a transition to clean energy. You know, the bill will cut household energy costs by an average of $500 a year, reduce carbon emissions and pollution that harm the environment and our health, and will create thousands of good-paying jobs and upgrade domestic manufacturing. And the legislation also makes a tax system fairer and deters tax dodging by large corporations and super wealthy individuals. You know, it provides the IRS with the resources to track down tax cheats and will require profitable corporations like drug manufacturers and oil companies to pay a minimum corporate tax. That 15% minimum tax will ensure big corporations will finally start paying their fair share. The Inflation Reduction Act consists of common sense reforms, many of them long overdue, that lower health care and energy costs for millions of people at a time when inflation is battering households. Now that the Senate has passed this bill, we stand in support of Congressman Pallone and the rest of our New Jersey congressional delegation in the House as they work to pass the Inflation Reduction Act without delay so that it can move to the President's desk for his signature and Americans can finally start feeling the benefits of these policies. Thank you.
Thank you, Laura. Of course, Laura's spoken about the other aspects of this bill, which I'm also very proud of, but we're focusing on the health care. But she's right when she says that this does a lot of other things that go beyond health care, particularly with regard to climate change. Now, last but not least is Evelyn Liebman, who's Director of Advocacy at AARP. And Evelyn, I remember how many times over the last, I'll say, maybe it was 20 years, that we had telethons and other things where we were talking about this bill and kept hoping that it didn't become law. So when I came in today, she was so excited. Thank you, Evelyn, for coming on.
Good morning. Thank you, Mr. Mayor, and everyone who helped bring this wonderful crowd together. On behalf of AARP's nearly 38 million members nationwide and our 1.2 million members here in the Garden State, as well as all older Americans, thank you, Chairman Pallone, for your years of work and characteristically modest description of your own leadership, the leadership that you have presented in this effort that has led us here today, along with so many of your colleagues, and your anticipated vote tomorrow to pass what is truly historic H.R. 5376, the Inflation Reduction Act. Since the founding of AARP in 1958, we have been working to make healthcare, and in particular prescription drugs, more affordable. It is your leadership and your vote tomorrow that will help bring down costs for seniors and families, helping them afford the medicines they need to stay healthy. And thank you, AARP members. I think we have some in the house. Yes, we do. The millions of AARP members who over the last years, in the last 3 years alone, over 8 million AARP members have picked up the phone, have sent a text, have sent an email to their elected representatives to urge them to act and lower the cost of prescription drugs and to make health care more affordable. You never gave up and never will to ensure older Americans have the health and financial security we all need and deserve. This bill, as you have heard, finally requires Medicare to negotiate lower drug prices. It is historic. It makes no sense that Medicare, with more than 40 million people enrolled in Part D plans, have been prohibited for so long from getting the best deal for seniors and taxpayers alike. Not only will this bill drive down costs for you and for all seniors, the nonpartisan Congressional Budget Office estimates that the provisional loan will save Medicare nearly $100 billion over the next 10 years. There are more than actually 1.6 million Medicare beneficiaries right here in New Jersey. The new $2,000 annual out-of-pocket cap will give real peace of mind to every senior on Part D. Too many seniors have been hit with drug costs of tens of thousands of dollars, an insurmountable sum for a population with a median income of just under $30,000 a year. Finally, drug companies that increase the prices of their products faster than inflation will have to pay penalties to the Medicare program. The days of consumers being forced to pay massive price increases year after year are over. Taken together, these reforms are the most significant improvements to bring down healthcare costs in more than a decade. As you've also heard, this bill will also prevent massive ACA premiums increases that could affect nearly 3 million people. This is so important, especially for our members who are aged 50 to 64, who pay the highest premiums, up to 3 times more than their younger beneficiaries. We are pleased that the bill extends this financial assistance for 3 more years. So thank you again for all you have done to bring attention to this issue. We can't overstate what a monumental improvement this prescription drug package will be for older Americans struggling to afford their medications. We look forward to working with all of you and with the chairman to ensure that this law continues to benefit older Americans for decades to come. And now, we are urging the House to move quickly tomorrow and enact this momentous reform. Thank you all for everything you do.
Thank you, Evelyn. I just wanted to assure everybody, because I could have waited and come here, I suppose, after the President signs the bill. But we have been waiting for the Senate to act on this since last November, when this passed the House, essentially. So the fact that the Senate passed it means that tomorrow there will be a vote. All the Democrats will vote to pass this, and we expect the President will sign it next week. So we're not talking about something that's not going to happen for a while. This is happening now, which is why we're here today, because we do think it's so important and we want to herald it. I didn't think we were going to have questions, but if some people want to ask something good.
It's up to you.
Does anybody like to ask a question? Go ahead.
I have an important question. By the way, I want to thank you. I'm with labor in New Jersey. You've been a friend of labor. I encourage everybody to support this man. He knows us. But I'm with labor, and I support support Mr. Pallone because we've always done the right thing for us. What I need to know is that we have an equivalent to prescription plan D, which is called Labor First.
Yes.
It's equal or the same. Our members will also benefit from the $2,000 cap and the $30 a month cap on insulin because we have the equivalent prescription plan. I need to know that answer.
The answer is
And
this.
number two, okay.
Bill, there's a second one?
No, one at a time.
Oh, so, I was trying not to sound like too much of a bureaucrat today. In order to answer this question, I'm going to sound like a bureaucrat, right? And again, I've been trying not to be too partial, but I'm going to have to. You know, there's a process in the Senate which is called, we refer to it as a filibuster, which says that in order for a bill to pass in the Senate, you have to have 60 votes, right? Which I think is crazy. I would get rid of it, but I'm not in the Senate, right? And we've been asking them to get rid of it. So right now, there are 50 Democrats in the Senate and 50 Republicans, and the Vice President breaks the tie, who's a Democrat. So what we wanted to do was to have all these things applied to, as some of the other speakers said, to the private sector, to the commercial sector, right? But in order to do that, you have to have 60 votes. The process where we're passing this in the Senate and also tomorrow is that is called reconciliation. It is limited to the budget, meaning the impact on the federal government, right? So Medicare is a federal program, and so you can do this with just 50 votes. You don't have to have 60. And that's all we got, right? We passed last week. The Vice President came in and broke the tie, and it passed. But if it doesn't relate to the federal government's budget, then you can't do it, right? So if we want to have the $35 for insulin to apply to everyone other than seniors, you need 60 votes. If you want to have the $2,000 cap on your drugs apply to everyone else, you need 60 votes. And we actually put the insulin cap in the bill just to test and see whether the Republicans would vote for it, and they did not, right? So the answer is everything that I'm talking about today applies to Medicare, not to everyone else. But what I pointed out, and this is, I think, the better answer to your question.
And I'm talking about seniors only, retired members of all the building trades in the United States.
But if it's your
retired members.
But if you were operating on a Medicare Part D,
yes,
sure it applies to you. But if it's a drug plan for the members who are not in Medicare, this doesn't apply.
We're all in Medicare. Everyone.
Well, then fine, sure, as long as you're in Medicare.
That's what I need to know.
Oh yeah, as long as you're in Medicare, it applies.
And the two things that have been killing labor in New Jersey are two things. They're blood thinners, Eliquis and Xarelto. The doctors will only prescribe these blood thinners, Xarelto and Eliquis. They won't prescribe Covidin because of all the side effects. And it's costing our senior retired members $800 a year because they're not at the poverty level. It's costing $800 for blood thinners. That's what's killing us. That's killing everybody.
What we're trying to point out too, because a lot of people have said to me, well, $2,000 cap, why isn't it $1,000? Why isn't it $1,500? But there are a lot of people whose drug bills collectively end up being more than $2,000 a year, and that's why we have the cap. Now, but I do want to emphasize that I believe, just from my experience over so many years of dealing with insurance companies, that if let's say Humira, if Medicare, because Humira is one of the drugs that will be negotiated, right? If Humira's price is set by the government under Medicare at a certain amount, there's no way that the private insurance companies are going to pay more than that. They're just not going to, because they're not stupid, and they're more into competition and making deals than anybody. So I do think that this will help and keep costs down for the private sector as well, but it doesn't apply to them because of the way we had to do this with the 60 votes. I hope you understood the bureaucracy of all that. It's true though. Any other questions? All right. Well, thank you so much.
questions privately. If not, enjoy the wonderful pastries that we have back there. Thank you.